Hello and welcome to the Arise interview. 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I'm Charles Enyegolu. Coming up in the next hour, as the death toll and the number of people infected by the new coronavirus in China continues to rise, cases have now been identified around the world and several African countries have introduced screening measures. On Sunday, Cote d'Ivoire announced the first suspected case on the continent, and Kenya is awaiting results of its suspected case. In Nigeria, there are concerns that hundreds of Chinese who returned home for the Lunar New Year could provide a path for the virus as they fly back to the country after their holiday. As Africa goes on full alert, we'll assess the risk of the pathogen being brought into the continent. Now, in today's ultra-connected world, it really is very hard indeed to confine an outbreak of a disease such as corona. Across the seas, a mere plane ride away, just a few hours in fact, Africa is now on full alert. In South Africa, Johannesburg's international airport, the OR Tambo Airport, is the only port of entry for direct flights from Asia. The South African government is saying measures have been put in place to assess the risk of the virus being brought into the country. So far, no cases have been reported in South Africa, but the country is on high alert. Across Africa, Kenya and Ivory Coast have reported one suspected case each, and they're still awaiting those test results, while in Ethiopia, the government said the initial tests on 4 students returning from China are negative. In Nigeria, there are growing concerns that hundreds of Chinese who returned home for the Lunar New Year could bring the virus with them as they return to the country after their break. We'll assess the risks in a moment. But first, here are international health officials speaking about the new coronavirus.
But the whole world needs to be on alert now. The whole world needs to take action and be ready for any cases that come, either from the original epicenter or from other epicenters that become established.
The level of commitment from China is incredible. Some people on social media, I will be open with you, were criticizing for praising China. I will praise China again and again because its actions actually helped in reducing the spread of coronavirus to other countries. Considering the last few days progress of the virus, especially in some countries, although the number is 68, and especially the human-to-human transmission in 3 countries, worries us. In Germany, in Vietnam, and also Japan. These are the 3 countries where we have witnessed human-to-human transmission. If this gets into a country with weaker system, then that could be problematic.
We just started an office in Beijing just recently, right? So I think for now there will be no need to charter flights to evacuate Africans out of Wuhan city. We have since activated our emergency operations center, which means we have now an incident management system for managing this outbreak across our continent, which so far we have not yet had reported cases, even though there are rumors of or unconfirmed cases in several countries. We have developed and circulated a weekly brief for the outbreaks to all member states and the diplomatic corps. We have engaged several African Union member states through their national public health institutes, which will be the equivalent of the CDC's, Centers for Disease Control and Prevention, to begin to network with them to coordinate our efforts in several areas. Firstly, enhanced airport screening, laboratory support, care and treatment, and care and treatment of patients. We are partnering with the Pasteur Institute as part of this network in Senegal to hold the first training workshop for 15 member states on laboratory diagnosis.
Well, for more on the risks posed to Nigeria and the rest of Africa by the new coronavirus, I'm joined now in the studio by an expert in clinical immunology and tropical diseases, Professor Sani Ibrahim, who's also director of the Directorate of Research and Innovation at Ahmadu Bello University Zaria in northern Nigeria, and by the Abuja editor of This Day newspaper, Ibrahim, who's been covering the global spread of the coronavirus. Thank you very much indeed to both of you for coming in. And I'll start with you, Professor Ibrahim. It does sound as though Africa does not have these cases as of yet, but there are investigations with those two cases in East Africa. We should know by the end of the day what the story is. So arguably, so far, good news there.
It is indeed. But the only problem I can tell you is the incubation period. Because sometimes a patient may walk into the airport without any symptoms, only to get home and develop the symptoms. And by that time, he must have been in contact with many others and so on and so forth. And you know the problem you have with this virus is its ability for human-to-human transmission. Otherwise, it wouldn't have been so much of a problem. But like you said, it's good news that so far so good.
So there's an element of stealth there.
Absolutely.
That it kind of sneaks in without you actually knowing that it's sneaked in.
Absolutely, because most of the screening tests are testing for high temperatures, meaning that the virus has already manifested itself, the incubation period is over. But before then, you may be asymptomatic like any other person, your temperature can be normal.
I would imagine that that's the most worrying aspect of all of this. But let me bring you in, Ibrahim, and give us the journalistic picture here. Can we say now definitively how many cases there are on the continent of Africa, or perhaps I should say suspected cases, because on the face of it, there appear to be 2 cases now in Africa, the first in Ivory Coast on Sunday. The 4 suspected cases that were reported in Ethiopia, the preliminary tests that were done have come back negative.
Yeah. Well, as of this afternoon, the latest report we have is that about 170 people, have died of the disease.
That's in China.
In China.
Yeah.
And about 7,700 have also been affected by the disease. So, if you look at the report in the last 24 hours, it suggests that the number is increasing. Because as at yesterday, it was about 132 those who died, and about 6,550 people were infected. So in the last 24 hours, the number has moved up, and that suggests that the whole thing is swelling.
In spite of all the Chinese are
exactly,
doing.
in spite of their all
right, and everybody's commended them for the way they're trying to get on top of this.
Technologies,
Right.
to control the whole thing. But like Prof said, I think the anxiety, the apprehension in Nigeria, for example, or in some part of Africa, is the fact that we might not have the capacity to be able to
Weak healthcare systems.
Yeah, exactly. So it's lacking. Like I said, I've read so many literatures about these things, and it is not just enough to text people coming into the country at the point of entry, because there are reports which suggest that the incubation is about 10 to 2 weeks before the disease can manifest. And that is why in part of the country, once you are coming from China, and there's an arrangement that you be quarantined for 2 weeks, where some 10 days. There are people also suggesting that they should be self-isolated, for 10 days or 14 days. And within that period, one could see whether the disease will manifest. So the approach by Nigeria, for example, I'm not very satisfied with it, because it is not just enough to check their temperature, or find out whether they are not infected. They immediately allow them,
release them
exactly.
into society.
So I think that is my fear. And the number of international airports we have in Nigeria, because we don't have the facility, enough facility to be able to detect all these in about 5 international airports within the country. We're talking about Abuja, talking about Kano, talking about Port Harcourt, we're talking about Enugu and Lagos. We have 5 international airports. I thought by now the federal government would have restricted the point of entry to 2, probably Lagos and Abuja.
Yeah,
so that we
the
can
sort of thing we're seeing in South Africa, where
Exactly.
everyone is coming in through the Oliver
exactly.
Tambo airport.
So that we can deploy all the facility we have
Yes.
to those 2 points of entry, so that we can proper manage this screening. Because you see, I'm afraid the volume of trade between Nigeria and China is very huge. Last year, I was in Beijing, and I spoke with the ambassador there, and he told me on a daily basis, over 1,500 containers leave Gwangju to Lagos Airport, which suggests that there's a volume, there's a huge volume of trade between Nigeria and Beijing. So we need to be very careful. We need to properly manage the whole situation. But let me also say that so far, the Ministry of Health has not proved that they are, is alive to its responsibility. The Minister of Health, for the first time, only gave us the latest information about 2 days ago. I expect by now, on a daily basis, they should be telling Nigerians what they are doing, the preventive measures, the proactive measures they are employing, to ensure that we don't experience this disease.
Yes, no, you have a point there.
Yeah.
I presume we've got to take a break in a few seconds, but I presume that everybody, particularly those in countries like Africa that, as you said, have weak healthcare systems, are waiting for that declaration from the World Health Organization, which will probably be, which to definitively declare this an international emergency. Just 30 seconds to have a word from you. Are you satisfied with what you're seeing Nigeria doing?
Yes and no. Yes, in the sense that the CDC, which is the agency that should be up and doing immediately on behalf of the minister, because the minister may just be a political appointee, but the people on the field doing the work.
That's the Centers for Disease Control.
Absolutely,
right.
That is one. And secondly, let us also put emphasis not only on those directly coming from China, but those that came en route.
Okay, through China.
Through
right,
China.
okay. Let me just ask you
yeah.
to hold that thought. I'll
Yeah.
come straight back to you. We're going to take a break. You're watching the Arise interview. Plenty more still ahead as we continue our assessment of the risks posed to Africa by the new coronavirus. Stay with us. Welcome back to the Arise interview. I'm Charles Onyekulu. Now, you might have heard that the Consumer Protection Agency in Nigeria says it has closed down a Chinese-owned supermarket selling illegally imported seafood and meat in the capital Abuja over ongoing fears about the spread of the coronavirus. The Federal Competition and Consumer Protection Commission, or FCCPC, said they made the discovery during a surprise inspection. The agency said that many of the products it found in the supermarket had irregular or expired dates. The goods were reportedly stored in a hidden area of the supermarket. The new coronavirus is believed to have emerged from illegally traded wildlife at a seafood market in China's Wuhan city. And this latest development comes as Nigeria and the rest of Africa are on full alert to try to prevent the disease from taking hold on the continent. Lagos International Airport has introduced screening measures, and some of the passengers traveling through the airport had this to say.
It's a viral infection and it may spread anywhere. No, because if we can beat Ebola, we can beat anything, no matter how deadly the virus is. So we have the Nigerian spirit and we can beat the virus.
It's not actually all over Asia currently, but as we know, because of the global travel and the mobility of people across, boundaries, so the likeliness of it actually spreading is quite high. Currently now it has been reported in other parts of Asia.
And with me in the studio, Professor Sani Ibrahim, who's an expert in clinical immunology and tropical diseases, and who's also director of the Directorate of Research and Innovation at Ahmadu Bello University Zaria in northern Nigeria, and Iyobosa Uwugieren, the Abuja editor of This Day newspaper, who's been covering the global spread of the coronavirus. Thank you for staying with us. And back to you, Professor Ibrahim. You were giving us your insights, your thoughts before we went on break on the measures that have been introduced in Nigeria to try to prevent the disease from getting into the country.
Yeah, like I said, let us not only concentrate on those that came directly from China, those that went en route other places also. So meaning that it is very important now to get the travel history of almost anybody coming in. The reason is this: our weak health system may not cope, because you can see how strong China is. They are able to start from scratch, raise 2 hospitals within a couple of weeks. Can we do that here? We're talking about taking decades to develop hospital, and by that time, whatever damage is this is. So that is one. On the other hand, our problem is that the problem you have with zoonotic diseases is that their reservoir are not human beings. These diseases have the ability to jump from their normal host to human beings. So a good understanding of that will be good. Secondly, there is a new concept in the entire health system in the world, which is One Health, in which case you have the veterinarians, the human doctors, as well as environmentalists, looking at whatever issue comes holistically and so on and so forth. There are a lot of moves in Nigeria. This is a classical situation where One Health regime can very easily handle these things more comprehensively and totally. So I am urging the CDC and any other person that various ministries must come together, Ministry of Health, Agriculture, Environment, and other stakeholders should put their head together and start seeing possibilities. Because if you are not proactive, because in a situation where you have a weak system, the best defense is to be proactive. Yeah.
And talking about being proactive, we did try to bring somebody from the Centers for Disease Control into the studio, as well as someone from the ministry, and they asked us to write a rather long letter to
This is the problem.
And so we don't have that kind of time, but we appreciate your being here.
And
Let me
I
talk
have
to
said, sir, again, that it's a pity that you do not have a clinician from such this. That would have been much better, because they will now show.
But in fairness to the CDC,
Yes,
and less to the Ministry of Health, we've had the CDC people, they tend to respond reasonably quickly by Nigerian standards to come into the studio. The Ministry of Health, another story altogether. Now let me bring Iyobosa Uwugieren in. Just looking at the measures that are being taken, quite a lot of traffic, as you said, between Africa and China. Do we know anything about airlines suspending their flights to mainland China? Because as I understand it, several African airlines do fly into China, and we know that British Airways has taken the lead, announcing that they are suspending their flights into mainland China.
Yeah, I agree with you. Where there are some countries, for example, this afternoon, Russia, for example, just shut their border.
Absolutely, and it's a monstrously long border.
Exactly. But I think for now, if you look at the airline coming to Nigeria, you have Ethiopia Airline from Abuja and Lagos and even Port Harcourt, Kano to Addis Ababa to Beijing. So which means that there are some, like for example, Egyptian Airlines also part of it.
Well, Egypt Airlines has actually cancelled all flights to China. So that's a good start. Kenya Airways has not suspended its flights, although I understand it's beefed up surveillance at the airport.
So I think there are so many African countries that have not taken that proactive measures. And that is why Nigeria need to be very careful. Now, the Prof talked about the need for the different agencies and ministries to, collaborate in fighting these, try to prevent this virus from spreading to Nigeria. Now, yesterday, I got my head correspondent, to interview the Disease Control Agency, and the response, really frightened me. They were saying that, we have all the equipment at the point of entry to screen them, but what they need to do is to ensure that the aviation sector and the immigration department are also alive to their responsibility, which suggests that, as at yesterday, they were not working closely.
There's no synergy.
There's no synergy.
Which is very frightening.
And that is what I got from that response from the disease agencies yesterday. So the point I'm making is that there ought to be a committee by now among the immigration, aviation, the Ministry of Health, even the Ministry of Agri, like Prof said. And environment. So that there should be a committee, so that when they are working in concert
with each other.
Yeah, so that so that when you are giving directive will go around immediately to all the agencies that are collaborating, trying to prevent the spreading of disease to
Right.
Nigeria.
Well, let me just make
that
this-
appears not to be happening as I speak to you now.
Sure.
Or as at yesterday when we spoke to
Well,
the
not
disease
to
agency.
sound too alarmist, we're also now hearing that Sudan has announced that it has 2 suspected cases, a man and a woman, and one of them flew in from Cairo, which is the point that you're making, that they've got to look at not just airline coming from China, and the other one flew in from Addis Ababa.
Absolutely, because these are the nightmare scenario. And if you do not have a complete travel history, it is going to be extremely difficult to listen. And like I said, what is important, a country like Nigeria, where we have all the human resources required. Talk of any specialization in medicine, you have somebody here. But the problem is the lack of synergy, where we work as a group and solve a problem collectively and comprehensively.
Well, let me ask you this from your professional point of view, as an expert in the immunology and these sort of diseases and things. Looking back, I mean, one remembers the SARS virus, as well as avian flu, swine flu, Zika, etc. I wonder, as the coronavirus spreads and governments in Africa and across the world struggle to put measures in place to prevent it from spreading, does it look like these global outbreaks are becoming more common?
Well, they will certainly become more common because emerging diseases, especially zoonotic ones, have to emerge because of the way we are messing up our environment. We are encroaching into the wildlife. And some of these viruses have been with their natural host for millions of years. And they have mutual contempt for each other. They don't cause any disease, and they only this. But when you encroach into that environment, either by way of hunting or by way of they are biting you,
or
any other
destroying
ways,
their environment.
absolutely,
I mean,
because they have nowhere else to go. So the chances of zoonosis jumping to, especially coronavirus, they are notorious for their ability to jump host, because other viruses are much less like that. And the second problem you have is that with coronaviruses as viruses, because we have to make one impression, viruses are not living things. They are on the verge between living and non-living. They only live when they live in a living thing. But however, when they are inert, some are notorious for their ability to be carried to the other living things. They have a way of surviving. So like I said, what is important is that because of the danger of such things, many experts, like people like us who are just scientists, many experts must put their head together in this thing. Another problem you have with it is that because of its ability to recombine, the antibodies your body produces against the virus that must have infected you are useless by the time you have the next cycle coming into you.
All right, thank you very much indeed for scaring the pants off.
No, it's the reality.
No, but you're absolutely right.
Absolutely,
And I appreciate your putting it clear.
Yes.
We've got about a minute and a half left, Yabosa. Of course, there are many more people in the world now, 7.7 billion on the planet, and as a result we're living closer to each other in much more densely packed communities, and as we live closer to each other we're seeing bigger slums, communities that don't have proper sanitation, don't have sewage, don't have access to clean water, and all that must increase the spread of disease.
You're absolutely right. I think you just give a very vivid descriptions of the situations in Nigeria. Our primary healthcare system is very poor. So much so that they also find it very difficult to respond to ordinary malaria, even Lassa fever. For example, look at the impact of Lassa fever in the last few days in Nigeria. It's really exposed the health situation in Nigeria, and that is why there's this apprehension that if we, God forbid, if we witness this kind of disease in Nigeria, it will be very difficult for us to manage. Whether we have the capacity to respond to this kind of emergency situations is a different thing entirely. Now, when this disease happened on the 1st of December 2019,
we've got 10 seconds.
The Chinese people did not even help matter. They were trying to suppress information about the whole thing. It was recently that after the WHO
Right.
confirmed the effect, that people started giving out more information on that. But
Okay.
like I said, Nigerians, we don't need to be, we need to plan ahead.
Okay.
We need to be
On
proactive
that
in our
note, I'm going to
measures.
say Iyobosa Wugieren and, of course, Professor Sani Ibrahim. Thank you very much indeed to both of you.